This segment of DelmarvaLife is brought to you by TidalHealth.
It's always fun to look back at old pictures to see how much has changed over the years. Well, almost.
Almost. Some people avoid looking at old pictures of themselves, especially if they have gained a significant amount of weight over the years. And if that amount is enough to put your health in jeopardy, TidalHealth can help. Dr. Melanie Ingram is with TidalHealth Surgical Weight Loss and Bariatric Nutrition, and she joins us this afternoon. Thank you for being here, Doctor.
Well, thank you for having me.
Oh, goodness. You know, we all do it. We look at those pictures and like, But, you know, weight loss is really important for our overall health. Why is that?
Well, we do know that when people have issues with their weight, where they're weigh more, there's higher risk for getting high blood pressure, type 2 diabetes, obstructive sleep apnea, and there's even an association with getting cancer.
So what is bariatric surgery?
So bariatric surgery is surgical procedures that we do to help people lose weight. So there's multiple different types that we have. There's the sleeve gastrectomy, gastric bypass. The lap band was something that used to be put in the past. We're not really putting in much of those, but there are surgical procedures that we do.
Okay, so of course everyone is talking all about the weight loss drugs that you're seeing a lot of celebrities taking and everything. What are the benefits of surgery as opposed to those drugs?
Well, what we know with surgery, that long-term weight loss is much more sustained. Typically with drugs, if you stop taking the drug, you're more likely to regain your weight. Also, the weight loss that can be achieved with a surgical procedure tends to be greater than what people can achieve with medications.
So who's eligible for the weight loss surgery?
How we determine eligibility is we use a calculated value. It's your BMI, it's body mass index. So they take your weight and they do some little tweaking with the numbers, and they use your height, and they come up with a number. So for someone to qualify for surgery, the BMI typically has to be over 40, or it can be 35 and up to 40, but you have to have comorbid conditions. So like type 2 diabetes, sleep apnea, sometimes reflux, degenerative joint disease, things like that can be utilized as a comorbid condition.
And from the time you have your first appointment to the time you have your surgery, what does that process look like and how long does it take?
The process, it starts with the education seminar, then we have you meet with a provider, a physician most often, and we talk about the different types of surgery, and then what might be needed from the patient to get them to surgery. And then once we kind of start that pathway, sometimes a patient may need to go for a sleep study, may need to have an evaluation with cardiology. Once we get all of that resolved, then we go to surgery. So it can take as little as 3 months, not common for a month, but it can take 6 months or longer also depending on insurance.
Okay.
So you start with the free seminar? Can you
Yes.
tell us a little bit about that?
Yes. So we have a seminar at our office. So if you are interested in this seminar, we would ask patients to either call our office or to go onto the website for TidalHealth. It's tidalhealth.org/loseweight. And so once you come to the seminar, then we talk about the various procedures and the process.
Worth looking into.
Yes.
Thank you so much, Dr. Melanie Ingram with TidalHealth Surgical Weight Loss. Good to see you.
It's good to see you. Thank you.